100 kids per day are having hospital operations to remove rotten teeth. The number of children needing tooth extractions last year jumped to 48,000, as experts warn the shortage of NHS dentists is creating misery in patients. Under new plans, dentists are to be offered cash incentives starting from £15 to see patients who haven't had an appointment in the past 2 years or longer. 90% of dental practices are no longer accepting new NHS adult patients, but why are so many people being left to go without?
The reason being, I believe, is because many NHS dentists are leaving the NHS. They are converted to private practices. The reason why I believe that dentists are leaving the NHS is because the contract's not fit for purpose. This was a contract that came out in 2006 and it hasn't had a reform since, unfortunately. This is something that I know that dentists have been asking for many years, and for whatever reason it just keeps getting put to the side. We have a waiting list at the minute of, you could say in excess of 600 patients. We could easily fill an NHS dentist if we were able to get one. But the problem is, we can't get one. We've tried, we've been advertising, and unfortunately dentists, coming out of dentistry school don't see NHS dentistry as attractive. They don't see it as a way of being able to work under the pressures of the contract as it is now. We need something in place now. We need to be able to see these patients now. This is not the practices not wanting to see patients. It is not the practices being greedy. It's down to the government so that we can work towards, giving good NHS care and making it work for all. And at the minute, that contract's just not working.
With more than 12 million people unable to get dental care last year, that's over 1 in 4 adults in England, it's more important than ever to educate ourselves on oral hygiene. Sarah Hunter set up The Helpful Hygienist on social media, where she shares useful tips for those with little options.
It's very, very sad, and I'm not quite sure what the government are going to do about it, but I kind of started this social media for the fact that how many people are on social media. The biggest thing is that when children are in dental, they're in pain. They're up during the night, they've got pain, and then they're missing schooling, so they're missing education, and that's hard on the teachers. We've already had COVID, we've already missed a lot of education anyway, and then for children to be missing education simply because they have tooth decay, which is a preventable disease. Dental professionals went into the career because they are passionate about it. It's not, and everyone thinks it's money grabbing, but it's not. It's not just about money that comes in because you're seeing a patient. It's about the time that you have with that patient, your staffing around that patient, or the training that goes with it. So it's not quite as simple as here's £15, can you see another patient?
But with the new £200 million dental rescue plan coming into force, can we be hopeful, or is it too little, too late?
I think it is probably a little bit too little, too late. We need immediate action, and I think the dentists, the amount of patients and also the amount of work that's going to be needed to be done on those patients that haven't been seen for years. They haven't been seen since pre-COVID, so some patients haven't been seen for 5-6 years. And because of that, they're having problems because they've stopped looking at their teeth because they haven't been going to see the dentist regularly.
What do you really think ultimately is to blame? Is it the government? Was it COVID? Is it both?
I think it's both, yeah. I think the lack of NHS dentists has had a huge impact. Yes, COVID has had a big knock-on effect, and it's staggered people back and it's knocked waiting times. But that's like that in all of the health service. But I think NHS dentistry was in huge problems before COVID came along.